What if I told you that what you think a heart attack looks like is completely wrong? You've seen it in movies 100 times. A man grabs his chest, falls to the floor, someone screams, the ambulance arrives. But here's what nobody talks about. Nearly half of all heart attacks in people over 60 don't start that way at all. There's no dramatic collapse, no crushing chest pain. Instead, it might feel like bad indigestion. It might feel like sudden exhaustion. Or it might be nothing more than a dull ache in your jaw that you brush off because you think you slept funny. And here's what makes it even more dangerous. According to the American Heart Association, 30 to 40% of people hospitalized for acute coronary syndrome, the medical term for heart attacks and severe chest pain, are 75 and older. And many of those people are living alone when it happens. Nobody there to call for help. Nobody there to drive them to the hospital. Nobody there to even recognize what's going on. That changes today. Because in this video, I'm going to walk you through 7 life-saving steps that could mean the difference between surviving a heart attack alone or becoming another statistic. And tip number 1, the one I'm saving for last, is something that most people have never even considered. It's not a medication. It's not an exercise. It's a simple action you can set up today that could save your life while you're unconscious and can't do a single thing to help yourself. Stay with me. This one is too important to miss. Before we dive in, I want to hear from you. Drop a comment right now. Tell me your age and where you're watching from. I read every single comment, and I'll do my best to respond. It helps me know who I'm talking to, and honestly, it helps this video reach more people like you. So take 2 seconds and do that now. All right, without further delay, let's get into it. Number 7, learn to recognize the warning signs that don't look like warning signs. This might sound obvious. Of course you should recognize the symptoms of a heart attack. But here's the problem. When you're over 60, your heart attack might not look like a heart attack at all. And that confusion, that hesitation, that moment where you think, nah, this is probably nothing, that is what kills people. Let me explain something that surprises a lot of folks. The classic symptom, the one everyone knows about, is chest pain. That heavy pressure, the squeezing sensation, the feeling like an elephant is sitting on your chest. And yes, that absolutely happens. But in older adults, especially women, the symptoms can be completely different. The American Heart Association has made it clear that older adults are more likely to experience things like sudden shortness of breath while sitting still, unexplained nausea, or vomiting, pain that radiates to the jaw, neck, shoulder, or even the back, sudden dizziness or lightheadedness, and an overwhelming feeling of fatigue that comes out of nowhere. Think about that for a second. Fatigue, nausea, a sore jaw. These are things most people would never connect to their heart. And that's exactly the problem. A doctor at Duke University, Dr. Christopher Granger, a cardiologist, put it perfectly. He said that for women, older adults, and people with diabetes, a heart attack might simply feel like weakness, nausea, or just feeling poorly, not chest pain, not anything dramatic, just feeling off. So here's what I want you to take away from this. If you're over 60 and you suddenly feel something that you cannot explain, don't wait. Don't sit around wondering if it's gas. Don't tell yourself you'll feel better in an hour. A heart attack is a time-sensitive emergency. Every minute that passes without treatment means more damage to your heart muscle, and that damage can be permanent. The golden rule? When in doubt, call 911. Period. Number 6. Call 911 first. Always. No exceptions. I know this sounds simple, but you would be shocked at how many people don't do it. They call their daughter. They call their neighbor. They try to drive themselves to the hospital. Some people even sit down and wait to see if it passes. Let me be very direct with you. If you think you might be having a heart attack and you're alone, pick up the phone and dial 911. That is the single most important action you can take. Not calling a family member, not searching your symptoms online, not trying to tough it out. Calling 911. Here's why that matters so much. Paramedics can begin treating you the moment they walk through your door. They can do an EKG right there in your living room, which tells them immediately whether you have a blocked artery that needs emergency treatment. They have medications, they have equipment, they have training that can literally keep you alive during transport. If you try to drive yourself, or if your neighbor drives you, none of that happens. You're just a person in a car hoping you make it in time. And when you arrive at the hospital by ambulance, you often get treated faster because the ER team already knows what's coming. They're already preparing. That time advantage is enormous. A Harvard study published in 2024 estimated that if people experiencing severe chest pain acted quickly in the first few hours, Over 13,000 heart attack deaths can be prevented in the United States every single year. 13,000. That's a small city worth of lives saved just by acting faster. So tattoo this in your mind. Step 1 is always 911. Everything else comes after that call. Number 5. Unlock your door and clear the way. Okay, you called 911. You're on the phone with the dispatcher. Now, if you can do it without too much physical effort, walk to your front door and unlock it. If your deadbolt is one of those that takes a key from the inside, unlock it. If you have a chain lock, take it off. Why does this matter? Because if your condition gets worse while you're waiting for the ambulance, if you lose consciousness, if you collapse, the paramedics need to get inside your home. If that door is locked, they're stuck outside. They might have to break it down, and that takes precious time. The 911 dispatcher will often ask you to do this, but I'm telling you now, so you can be ready. Make a habit. If you live alone, consider keeping a spare key in a lockbox outside your door, the kind realtors use. Give the code to your emergency contacts and write it on your fridge. While you're at it, if you have pets, close them in another room. I love dogs. I love cats. But a confused, scared pet can get in the way of paramedics trying to save your life. A dog that barks and blocks the hallway. A cat that darts underfoot. These are real obstacles that slow down emergency response. This might sound like a small thing, but in a heart attack, small things add up, and every second counts. Number 4, sit down, stay calm, and do not exert yourself. Now, this is where a lot of people make a critical mistake. The moment they realize something is wrong, they panic. They start pacing. They rush around looking for the phone. They run to the kitchen to grab water. They go upstairs to get their medication list. Stop. Sit down. Right where you are. Exertion during a heart attack makes everything worse. Your heart is already struggling to get enough blood and oxygen. Every step you take, every stair you climb, every moment of physical effort demands more from a heart that is already in crisis. You're essentially asking a drowning person to swim faster. A cardiologist at Vanderbilt Heart and Vascular Institute, Dr. Sean Gregory, explained that anything that increases the stress on your heart during a heart attack can worsen the damage. Physical exertion is one of the biggest culprits. Instead, find a comfortable position. Sit in a chair or on the couch. Lean back a little. Breathe slowly and deeply. In through your nose, out through your mouth. This isn't just about relaxation. Deep, controlled breathing actually helps deliver more oxygen to your blood, which is exactly what your struggling heart needs right now. I know it's terrifying. I know every instinct tells you to move, to do something, to fix it. But the bravest and smartest thing you can do in that moment is sit still and wait for professionals to arrive. Let me also clear up a dangerous myth while we're here. You may have seen something circulating on social media about cough CPR. The idea is that if you're having a heart attack, forcefully coughing can somehow keep your heart going. Cardiologists at Johns Hopkins, Vanderbilt, and many other institutions have all said the same thing. Do not do this. Cough CPR is not recommended for heart attack patients. It could actually increase the stress on your heart and make your condition worse. During a real heart attack, you are usually still conscious. Your heart hasn't stopped. It's struggling, but it's still beating. CPR is for cardiac arrest, when the heart stops entirely. They are not the same thing. So please, ignore that viral post. Sit still, breathe, wait for help. Now, before I get to the top 3, and trust me, you'll want to hear all of them, do me a quick favor. If this video is giving you information that you think could help someone you care about, hit that like button right now. It takes 1 second, and it tells YouTube to show this video to more people who need it. And if you haven't already, subscribe and turn on notifications so you don't miss the next one. We put out new videos every week designed to help you live longer, healthier, and more independently. All right, let's keep going. Number 3, if you've been prescribed nitroglycerin, use it as directed. Now, this one applies specifically to people who already have a diagnosis of coronary artery disease or who have been prescribed nitroglycerin by their doctor. If that's you, pay close attention. Nitroglycerin is a fast-acting medication that relaxes your blood vessels, which takes pressure off your heart and helps blood flow more freely. According to both the American Heart Association and the American College of Cardiology, nitroglycerin is considered a first-line treatment for acute coronary syndrome. It works fast, usually within 1 to 5 minutes. If you're having chest pain and your doctor has prescribed nitroglycerin, here's what you do. Sit down first, because nitroglycerin can lower your blood pressure and make you dizzy. Place 1 tablet under your tongue and let it dissolve. Don't chew it, don't swallow it. Just let it sit there. If the pain hasn't gone away after 5 minutes, you can take a second dose. 5 more minutes and still hurting? A third dose. But listen carefully. If you've taken 3 doses in 15 minutes and you still have chest pain, this is an emergency. Call 911 immediately if you haven't already. Now, here is something incredibly important that I cannot stress enough. Never, ever take someone else's nitroglycerin. That medication was prescribed for them based on their specific medical history and conditions. Taking someone else's medication, especially a powerful vasodilator, can cause a dangerous drop in blood pressure and do more harm than good. And one more thing, nitroglycerin does not play well with certain other medications. If you take anything for erectile dysfunction, drugs like sildenafil, tadalafil, or vardenafil, combining them with nitroglycerin can cause severe, potentially life-threatening drop in blood pressure. Make sure your doctor knows everything you're taking. Number 2, know what not to do. The myths that can kill you. This one frustrates me because there is so much bad information out there. Social media is full of heart attack tips that range from useless to outright dangerous. Let me set the record straight on a few things. First, let's talk about aspirin. For years, the standard advice was chew an aspirin at the first sign of a heart attack. And there is some science behind this. Aspirin prevents blood platelets from clumping together, which can help keep a blocked artery from getting worse. But here is what has changed. The American Heart Association has updated its guidance. Their current recommendation is that if you're having heart attack warning signs, call 911 first. Do not take an aspirin and wait for it to relieve your pain. Do not postpone calling 911 to find aspirin. When you call, the 911 operator may recommend taking aspirin based on your specific situation. They'll make sure you don't have an allergy to it or a condition that could make it risky. Why the change? Because not everything that feels like a heart attack actually is one. Severe chest pain can also come from an aortic dissection, which is a tear in the major artery leaving your heart. In that situation, aspirin, which thins the blood, can make internal bleeding significantly worse. A stomach ulcer can also mimic heart attack symptoms, and aspirin could worsen that too. So the bottom line? Call 911 first. Let the professionals decide whether aspirin is right for you in that moment. Don't self-diagnose and don't self-medicate. Second myth, do not eat or drink anything other than a sip of water, if absolutely necessary, to take a prescribed medication. Having food or beverages in your system can complicate the emergency treatments paramedics need to give you. It might seem harmless, but it can create real problems when you get to the hospital. Third myth, and I already mentioned this, but it bears repeating. Do not try cough CPR. It doesn't work the way the internet says it does. And one more, do not try to drive yourself to the hospital. I cannot emphasize this enough. You could pass out behind the wheel. Your condition could worsen rapidly. You would be putting yourself and every other person on the road in danger. That is never the right call. And now, the moment you've been waiting for. Number 1, invest in a medical alert system. Today, not tomorrow. Today. I saved this for last because I genuinely believe this single step could be the most important thing you do for your survival if you live alone. And I'll tell you why. Everything I've told you so far, every tip, every piece of advice, it all depends on one thing, that you are conscious and able to act. But what happens when you can't? What happens when you're in the bathroom and you feel dizzy and you collapse before you can reach your phone? What happens when you're asleep and your heart goes into a dangerous rhythm and you never wake up to call for help? That is where a medical alert device becomes a literal lifeline. These are the small wearable devices, usually worn as a pen around your neck or a watch on your wrist, that connect you to a 24/7 emergency monitoring center at the push of a button. Some of the newer models, and this is the part that really matters, come with automatic fall detection. That means if you collapse, if you fall, if you suddenly stop moving, the device can detect it and send an alert to trained professionals on its own. You don't have to press anything. You don't have to be awake. You don't have to be conscious. The device does it for you. Think about what that means for someone who lives alone. It means that even in your most vulnerable moment, even when you can't help yourself, someone is being notified. Help is on the way. And here's something else a lot of people don't realize. Living alone is itself a risk factor. Research has shown that living alone can increase the risk of heart disease by 29% and stroke by 32%. Part of that is because when something goes wrong, there's no one there to recognize it and respond. A medical alert system fills that gap. I'm not here to sell you a specific brand. That's not what this is about. What I'm telling you is that if you are over 60, if you live alone, if you have any history of heart problems, high blood pressure, diabetes, or high cholesterol, this is not optional. This is essential. Talk to your doctor about it. Talk to your family. And set it up, not next month, not when you get around to it. Do it this week. Because the truth about surviving a heart attack alone isn't complicated. It's not some secret formula. It's about being prepared before it happens. It's about having the knowledge to recognize what's going on. It's about having a plan so that in those critical first minutes, you don't freeze, you don't panic, and you don't waste time. Let me bring it all together for you. Getting older doesn't mean you have to live in fear. It doesn't mean you should spend your days worrying about what might happen. But it does mean being honest with yourself about the reality of your situation. Heart disease is the #1 cause of death in the United States. That's not a scare tactic. That's just the truth. And the difference between the people who survive and the people who don't usually comes down to a handful of decisions made in a very short window of time. Know the signs. Call 911 immediately. Unlock your door. Sit down and stay calm. Use your prescribed medications correctly. Ignore the myths. And give yourself a safety net with a medical alert system. You know what the most encouraging thing about all of this is? Heart attack survival rates have improved dramatically over the past few decades. Back in the 1970s, a person over 65 hospitalized for a heart attack had about a 60% chance of leaving the hospital alive. Today, that number is over 90%. We live in an era of incredible medical capability. The science, the treatments, the technology, they're there, but they can only help you if you get to them in time. So here's my question for you today, and I want you to answer this honestly in the comments. Do you have a plan? If a heart attack hit you right now, this minute, while you're watching this video, do you know exactly what you would do? Have you talked to your family about it? Have you set up a system? Or is it something you keep meaning to get to someday? Tell me in the comments. I want to know. And if you have a story, if you or someone you love has been through this, share it. Your experience could be the thing that saves someone else's life. Thank you for watching. Share this video with someone you care about. I'll see you in the next one.